having primary care providers who are well equipped to deal with behavioral health, anxiety, depression, OCD, bipolar disorder, all of these types of conditions that we see in our patients that we take care of, is a really important part of training the next generation of physicians, and you can do that here at UW.
We have a strong behavioral health curriculum and integrated care model. Every resident receives in-clinic coaching to support development of patient-centered skills for quality care and time management. The longitudinal curriculum in behavioral health and psychiatry covers basic patient-centered and trauma-informed care and training in addiction medicine, assessment and management of common psychiatric problems, behavior change counseling, family-centered care, and brief behavioral interventions.
What's unique or valuable in our curriculum is it's longitudinal. It happens over all 3 years. And the core of it is based in direct observation, and we have a unique model where we have physicians and behavioral scientists observing together and giving coaching in the moment. And every resident is observed at least 4 times a year over the course of all 3 years. The curriculum itself covers both behavioral health and psychiatry, and the behavioral health components start with the basics, patient-centered interviewing and trauma-informed care starting out in the first year, behavior change interviewing in the second year, and in the third year we really go into more complex and advanced skills.
Our psychology trained folks, the folks who do our direct observation, whether that's faculty, they make it pretty seamless. We're able to kind of sit with our patients, whether they're in the room, the faculty observing anyway, they're kind of like flies on the wall. They sometimes are observing us from a computer screen via telehealth, and there's really little to no pressure, and I don't feel like I have to put on a facade for them to try and be my best I can absolutely be. It's very relaxed. And then afterwards, the most beneficial thing is being able to talk about not necessarily tips and tricks of how to be a better doctor, but honestly looking at some of the things that we do unconsciously, whether that's kind of our body posture or certain quirks that we have, things that we repetitively say, in addition to trying to find good opportunities and good ways to discuss things with our patients and kind of better ourselves as physicians.
I work at the Northgate Clinic, and we're very fortunate to have an integrative behavioral health team. And I think that's one of the particular strengths of our program is that we actually have this designated group of people where if you're having a patient who's having a crisis in your clinic, you have people there available for a warm handoff. And having that integrative approach really expands our capacity as primary care doctors to be able to care for our patients.